All right. All right. Good morning, good afternoon, good evening, depending on where you are watching this. This is the voice on the face of Dr. Tolu Olabintan, CEO, founder of Living Spring Family Medical Center here in the good city of Mansfield, Texas. And I'm here doing another live, all in the name of helping you live long and well. I'm really excited about this guest, Dr. Nerissa Bauer, who is a behavioral pediatrician and the founder of Teach Me ADHD. I'm so happy to have you here. Yay. And today we'll be talking about Teach Me ADHD in honor of her logo, of course, the Kiddie version. So, that being said, I'm going to hand over to you, Dr. Nerissa. Please kindly
Yes.
introduce yourself again and tell people who you are and what you do.
Oh, thank you for that. And I'm so excited to be here with you this morning. Thank you again. So I am Dr. Nerissa Bauer. I'm a behavioral pediatrician, and I will explain to you what that means in a second. But I am calling in from Carmel, Indiana, in the middle of the country. And my passion is really to help families connect, communicate, and collaborate around pediatric behavioral mental health issues
Mm.
because it can be stressful. And I want to make sure that when a diagnosis is first made, or if, families are just needing to kind of get just back on track,
Mm.
I want to help empower families to be able to know how to work together, because in the end, that's all you've got. You've got the team, and you need to be able to work together and have positive parent-child interactions.
Awesome, awesome. And I've seen you do what you do. I've watched some of your lives. I mean, you're pretty awesome. And I'm glad that patients and parents and their families have an opportunity to work with you. But
Mhm.
people are curious minds want to know why do you do what you do? What is your story behind it? How did you get involved in all this?
Oh, well, I mean, there is a story. So, when I was training back in the day, shortly after I graduated from residency, I was in San Diego at the time.
Okay.
I realized very quickly that I wanted to help kids and families specifically around behavior and development. One of my most important mentors who has helped shape me as who I am today, Dr. Marty Stein, shout out to him. He's one of the grandfathers of the field. And when I rotated with him, I realized this is what I want to do. Like, I would watch him in fascination, just kind of sitting with families and just pulling things out like
Wow.
effortlessly, right? I mean, and really about things that I felt a pediatrician should be able to talk with and support families, mainly family dynamics, parenting concerns. How is my child doing at home and school? Those kinds of things, right? And because of that experience and how I was so inspired, I mean, he actually asked me if I would be his fellow,
Oh,
which means that, I would get an extra year training with him specifically. And I was like, yeah, of course. Um,
no
and,
brainer. Uh-huh.
no brainer. But then after I finished that, I ended up going to Seattle to get my master's of public health. While I was there, I was asked to start a foster care clinic. Now, but I bet you didn't know this whole story, but um, as you know, kids in the foster care system, they have a lot of behavioral and mental health
Mhm,
issues just because
mhm,
of the
mhm,
trauma,
mhm.
everything that they've been through. And I quickly realized that I did not have the information I needed to support these families. Yes, medicine, I could prescribe it, but that was not really what was needed. The families needed help to understand how to support and meet these foster kids where they were, so that way they could all get along. But I didn't have kids at the time, and I was like, oh my gosh, I do not know how to help these families. So enter in Dr. Carolyn Webster Stratton, another formidable like mentor in my who helped shape me and
Mhm,
gave me
mhm.
a once in a lifetime opportunity to learn from her. She's the developer of the Incredible Years parent training program. Needless to say, I she gave me this opportunity to sit and learn, observe, and also meet with her and her trained facilitators, learn how to not only
Mm.
what the content was, but how to deliver it. And I realized then that pediatricians, when we're trained, at the hospital, we're
Right.
really trained to help kind of understand like what's normal behavior, what's not normal
Mhm.
behavior, what's sick and not sick, right? We want to be able to keep kids healthy. Um, but there wasn't really a lot of emphasis or a way to help families understand like how to play, how to praise, how to do timeout, all those things that you would think a pediatrician would know how to do. And so I really made that my mission to, especially in the setting of kids with ADHD, anxiety, depression, how do we get families to connect, communicate, and collaborate together? Because that's what we need to do, especially in those rough moments when there are challenges that are outside of our kids' control, because we know that these things are brain-based conditions. Um, how can we help support them so it's not as scary, not as overwhelming, and then also help the families?
Awesome. I love what you do. And there's a phrase, it takes a
Mhm.
village to raise a child. You
Oh,
essentially empower the village to empower the
yes.
child. Wow.
Yes.
All right. So wow. I love what you do, and I'm glad that you exist.
Thank you.
All right. Now, for those who are watching who are wondering, well, what is ADHD? Not the technical term, but how would you explain
Mm.
what is ADHD?
Yeah. So ADHD stands for attention deficit hyperactivity disorder. Very fancy lingo. And I always tell the kids too, I'm like, that's a lot of words, a lot of big words. So we've got to break it down, because I want to make sure that anytime they hear anybody saying that, whether that be me, a therapist, a psychologist, a school person, parents, I want them to know what it is, right? And so it really is a disorder or a condition that affects the brain. And whenever I teach kids, I always use models and I tell them, don't worry, your brain is not really green.
I was like, that's a
you know,
functioning brain. Of
yeah, right, right. But I mean, kids like to see things, especially
course.
individuals with ADHD, right? We need things visual. And so I really walk it down and I actually try to explain to them, that sometimes like when kids have a hard time breathing, they have asthma,
Mhm.
that means that their lungs are not working as well as they should. And, so simply put, ADHD means that kids who have ADHD or people who have ADHD, they think and learn a little bit differently. It doesn't mean that you're not smart. It doesn't mean that you're not capable. It doesn't mean that you can't do things. It just
Right.
means that you need to learn how to work with your brain. Brains with ADHD, sometimes they're described as brains with Ferrari. It's like a Ferrari brain because it's always on the go. And you got to learn how to put the brakes on, and when to put the brakes on. And also, our ADHD brains are super creative but they're like always kind of thinking about things but then sometimes they're distracted. And so, we've got to learn how to kind of rein in all of that. So
Mhm.
that way when you're at school, you can do what you need to be doing at school. And when you're at home, you can be listening to parents and doing what you need to be doing. But then also in learning how to embrace what ADHD is because it's a part of you. We can't get rid of it. It's a lifelong condition. And it's not a disability, it's a unique ability. We just have to learn how to harness it.
It's not a disability, it's a unique ability. So you have a special, very fast brain, fast brain, and you just need a little help with navigating. I love that.
Yeah,
I love that.
yeah.
It's not a disability, it's a unique ability. Love it. Love it. Love it. Love it. Now, more and more kids are being diagnosed with ADHD and parents are worried. Is there a cause for this trend? Is there something we should be on the lookout for parents who are expecting, or like, what are your thoughts, Doc?
Yeah, well, so we know that it's not just one thing. I
Right.
mean, we know that first of all, ADHD is highly heritable. So, when this is often a very common scenario when I make a diagnosis of ADHD and we are beginning to sort of teach about it and learn all about it, parents are like, "Oh, oh, wait, I might be like that too," and that's very common because like I said, ADHD runs in families, okay? So that's one way. But the others are a little bit multifactorial, meaning that there's not one singular cause, but some research studies have shown, like low birth weight, exposure to smoking
Mm,
during pregnancy, head trauma, those types of things. There are some people, especially now, who believe that maybe exposure to screens and the world that we live in, because we're training our
mm,
brains to not be able to focus very long, right? I mean, it's really fascinating because if you were to watch Mr. Rogers, which is what I grew up with, like it
Yes.
is so slow. Like
Motion
I
type
know.
show. Yes.
But now today everything's like boom, 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 like, and your brain is like needing that instant gratification, right? And all those dopamine hits. So, I mean, I'm not saying that it necessarily causes ADHD, but it certainly has made it worse. Like it's amplified the fact that we live in a very different time right now. And there's other things that people think about, like, is it due to sugar? Is it due to artificial dyes? Is it due to gluten? And there have been studies that show that a certain subset of kids can be sensitive to those things,
Right.
but it doesn't cause it.
Awesome.
It
Okay.
can make those symptoms a little bit worse.
Okay. I'm going to segue a little bit now. You mentioned the, fast-paced type TV shows that we're having now for social media, and some of our kids are exposed to social media as
Yeah.
well. And also, we are also, constantly being entertained, I guess. Would you suggest, for ADHD kids to maybe limit, or like how would you advise if a parent is saying, oh, so does that mean my kid can't watch TV because all the shows are like this? What would you say to that?
Well, I mean, I think it's true for anybody, regardless of anybody who, if you have ADHD or not. I think
That's true.
anything is healthy in moderation, right? I mean, not all screens are bad,
Okay.
because there are a lot of awesome things that technology has afforded us. Look, we're connecting like
That's
with
true.
people, right? We have connections.
True.
We don't have to necessarily just be limited to people in our geographic location or in our neighborhood. Like we can actually connect with people
True.
globally now, which is
True.
amazing, right? You can search on, for things on these things, I mean, like, and get information right away.
Right.
And there are a lot of awesome things that we can do on screens. So not all screens are bad, and certainly the research shows that.
Okay.
But the thing is that, especially like for instance, for young kids, infants, right? The American Academy of Pediatrics suggests limiting screen time use to only FaceTime,
Okay.
like like if you're talking to grandparents, things like that,
Right.
but
Right.
more importantly, stressing the face to face time in
Okay.
person with no screens, right?
Okay.
Because kids, that's a very critical part of language development,
Development.
and
Yeah.
we've got to have that back and forth, right? Because what happens when you put a child in front of a screen? Oftentimes it's passive. They're not necessarily talking, they're just consuming, right?
Mm.
And we don't talk to them. We don't we So we severely limit our interactions and the words they
Uh,
hear, right?
mm.
But as they get older, I think it's really important to sort of talk to kids about, like, okay, we need to use screens. I use it for work, you use it for school. There are certain things that we like to do, but we acknowledge that. But we also need to understand that, especially kids with ADHD, their brains tend to like really like hyper focus on that, meaning
Right.
they can do it for hours. And anything to that extreme is not really good. It's not really
Okay.
healthy.
Okay. So
So
balance is key. Balance is
balance.
key. Emphasized. All right.
Mhm.
Awesome. Now, some parents will worry after a diagnosis that it's the label. ADHD or any kind of, how do you help ease families' concerns about this? The
Mhm.
labeling.
Yeah, so, I mean, in order to make a behavioral diagnosis, mental health diagnosis, unfortunately, there's no imaging study or blood test. I can't swab your throat and say, "Hey, it's this," We
Right. Right.
really need to understand what's going on and the context. And because of that, in order to help other people on our team, teachers, daycare providers, bus driver, anybody who's working with that child,
Right.
they need to they need to know what's going on, because otherwise they're just seeing a kiddo's behavior and they may mislabel it.
Okay.
So it's really important that this quote label or diagnosis is there for a positive, meaning that at least we know what's going on. And when you
Okay.
say a word like ADHD, it sort of helps people understand, oh, okay, that's what
Right.
this means.
Okay.
Okay. I mean, it's really important, especially because, again, like I said, it's ADHD has a lot of different ways it can present. There's more the hyperactive impulsive type, there's more the inattentive type, there's a combined type. So it sort of just starts forming like at least some sort of picture of
Okay.
what that child needs.
Okay.
Okay. But I will say that, of course, the flip side is that there's also a lot of misinformation out there,
Right.
right? And that's why sometimes that label can lead people to think, oh, just lazy, stupid, not, needs, a lot of reminders, those kinds of things. And it's not true. But again, that's why it's so important to educate everybody about what it is and what it isn't.
Okay. I love that. So it's a way to help you understand the behavioral language of the child, that label. Okay. It's not supposed
Yes.
to be used in a negative light. It's supposed to help, we communicate like this is how this patient or this person communicates language wise or
Hmm.
behavioral wise. I mean,
Hmm.
so it's not supposed to be, and that's why the education is important. The diagnosis is not, it's not a disability, it's a unique ability. And this is how this child communicates in behavior.
You got
Very,
it. You
very
got
important.
it.
Now let's go right into non-medication treatment options. Um, you've been doing this for a while, so people are wondering, like, are there other options? Every time I go to my doctor's office, the only option sometimes they give me is medication, and I don't want that. I want to try something else. What options would you say are available for parents and the child with ADHD?
So I will start off by saying, medicine is one of the five pillars, right? But it's not the only thing. And so thank you for asking this question. So in addition to medication, the other four that we always talk about, or I try to talk with my families about, is, what are, first of all, the self-care strategies that you can do so that way you can be functioning optimally. Because when we don't get enough sleep, when we don't get exercise, when we don't eat the right foods, those all contribute to our mood, our ability to concentrate, our ability to regulate our emotions. So those are things right off the bat that we need to start talking about, because those are things that we know can really help set the bar at a better starting point, right? So I would say that's super important. And we can teach kids that as early as we need to, because then they start taking ownership of that and they learn the why. Because when they hear parents say, go to bed, it's time to go to bed, or you need to eat, broccoli,
Yeah,
well,
yeah.
they're just going to push back because they don't really understand. But when you
Understand.
can explain that our brains need to be fueled, not just our bodies, and this is why, so then that gets some buy-in. Okay. So self-care strategies like
Self-care.
that. Okay.
Yes.
This next one is behavioral therapy.
I hope you guys are
So,
taking notes, because I'm taking notes. Okay.
so
Um,
behavioral therapy, what is that? So I explain this to kids that, some kids just need additional help learning skills, because even if you start medicine, let me just tell you this, medicine does not teach skills. It's important because
mhm.
sometimes the the symptoms of ADHD, not being able to sit still, being impulsive, not being able to focus, those things we know can be helped with medicine. We know that. I mean, right? But it does not teach you how to organize, prioritize, manage your time. It doesn't teach you how to, really control those emotions. And we know that ADHD is much more than just a behavior diagnosis. It's a condition that affects executive function.
Hmm.
Executive function is a set of cognitive skills that help you navigate life. So, it helps you kind of plan, prioritize your days, go through sequences. I mean, all of those things. So a pill does not teach you to do that. Like, you still will have to learn how to do those things. And that's what behavior therapy is for. Behavior therapy
Medication.
helps you, yeah, learn those skills to set up systems so that you can thrive.
Medicine
Okay.
doesn't teach skills. I love that. By the way, Parameshwari says she's taking mental notes.
Okay.
And Dr. Una is here. She says hi. My doctor's here too, says hi.
Woo.
Also, but I love that. And you mentioned something that's very important. And this I wanted to highlight again. ADHD affects executive functioning, the ability to
Yes.
make, like, what's a priority, what should you focus on right now versus not. and things like that. And so behavioral therapy is very, very important with or without medicine.
Yeah,
Awesome, awesome
absolutely,
point.
absolutely, absolutely. And the other thing that I do want to say about this is that, aside from that, kids need to understand that, their brains just, again, think and learn a little bit differently, right? So everything needs its place because otherwise, it's out of
Mm,
sight, out of mind. I mean, that's just the nature of how it is, right? So as kids learn how their brains work and what they need, hopefully we can empower them to, sort of think through, okay, if I do it this way and set a routine, it becomes easier for me, right? It's not that I can't do it. It's just that my brain needs a jump start, you know. So again, we look in my class that I've developed, Teach Me ADHD, we become detectives. We look for clues. We look for things
love it.
like trends. We don't jump to conclusions. We don't do any shaming or judgment. It's just we're looking for the facts. That's all, right? So behavioral therapy, that's important. Um, Parenting support. I always tell the kids that this is something that is available, but that they don't need to worry about. This is something for their parents to think about. But I tell them this because sometimes kids might feel singled out. Like, I'm the one that has to take the medicine. I'm the one that has to go to the therapy appointment. I'm the one that has to see the doctor and talk to them. I'm the one that has to, get tutoring, right? They think it's all about like something's wrong with
With
them,
them. Mm,
But I also tell them, um, chances are that when you realize what's happening, families and parents need to also understand how to best work together with you. Because believe it or not, sometimes some parents find out they have ADHD too, and or right, they learn how to better communicate with you. They learn how to better help support you. And
mm,
so parents will need their own parenting support,
support.
right? And I always tell them that. So that's the another pillar, right? So that's separate from kids and, so that way everybody's educated. And then lastly, working with the school, because when kids are, you know, going through school, school is going to be the biggest stressor on executive function, especially as they get older. Their brains are going to be working harder to
Mm,
keep up, and every year you need to be reevaluating how that child is doing at
mm,
school. And sometimes they might need just extra time to take tests or maybe be in a separate room so there's not a lot of distractions. Or before COVID, they might have
mm,
needed extra set of books at home because they're always forgetting what to bring home, but now we're all on electronic. But, the flip side is sometimes some kids still need to write things rather than seeing things on the screen because it's kind of hard to process that way. So, I think part of it is understanding what's challenging about doing what you need to do at school and then being able to partner with the school to figure out how to best support that child, and be on the lookout for, um, learning disabilities because ADHD seldom
comes by
runs
itself.
alone. It,
Mm,
it like anxiety, depression can happen, co-occur, learning disabilities. So again, together with your doctor, you need to be kind of monitoring this because it's oftentimes when you get the diagnosis of ADHD, you're not necessarily going to get the other diagnoses. Sometimes they don't show themselves until a little bit later, but that's why you need to be kind of monitoring year to year and talking with your team like, okay, how are we all doing, so these are the components of the ADHD care plan, and I really really encourage parents and kids to be an active participant in that because this is all about setting them up for success. This is all about that.
it's all about setting them up for success. So the whole team is involved: the school, the parents, the child, of course, the medications, behavioral therapy, and of course, we encourage these are medical suggestions. Really important for you to take time to meet with your doctor,
Yep.
ask questions, and get individualized care. This has been very, very helpful. I love it. It's a team approach. It's a team approach. Now, next question for you, Doc. Three or four things. How can parents empower their kids with this diagnosis or with this unique ability? Three or four things, pointers for those who are watching, and I'm taking notes too. Mhm.
Yeah. Yeah. So one is after the diagnosis, make sure you educate yourself. right? Because like I said, there's a lot of misinformation out there about what ADHD is and what it isn't. And I would also say that the reason I really developed the Teach Me ADHD course is because I try to put myself in kids' shoes, right? I mean, I want you to think about, like, for those of you who have kids with ADHD, when you got the diagnosis, was your child with you? Where were you? Were you at the doctor's office? Were you at a psychologist's office? And how was that information given, right? Because oftentimes, the child will be in the room and they hear, oh, I think he or she has ADHD, right? And depending on the age of the child, they might be like, what is that? Oh my gosh. Did I do something? Is that wrong? Is that bad? Am I gonna get, like, is that something that I can get rid of? Like, what is that? Right? So I don't want kids to be overwhelmed or panicked. I want them to know from the get-go that it is not something that's wrong with them. Okay. And so it's so important to be able to talk with your child about what ADHD is and what it isn't. So that's why I tell you, parents, to make sure you educate yourself, but also don't be afraid to start those conversations with your child. And I love using children's books for this. I have a short list of children's books that I love around this topic. It's an easy way to
Hmm.
bring up the subject by reading a book to them and then kind of saying, oh, what do you think about that? Did you see parts of yourself in that character, or
Ah,
things that happened to you? And that way it sort of just helps start that conversation. So it's not like a magnifying glass on them. You're kind of easing into that conversation with a
mm,
story that maybe they can relate to, that maybe they can see themselves in.
and
And then you sort of stop and reflect and be like, hey, what did you think of that story? Does that ever happen to you? Do you ever have a hard time? And just getting curious about what ADHD is together can help parents and kids start to connect around it, right? And again, parents, you do not need to know all the answers, but you can say, oh, wow, I don't know. That's a good one we need to write down. And next time we go see the doctor, we can ask them, right? We're looking for clues. We're trying to find the facts. Okay. And then you can also ask them, what have you heard about that? Do you know anybody else who has that? Right. And in my class, the first session, we talk about what ADHD is, what it is, and we break down those big words, right? I ask them to self-reflect on, what have they ever heard those things about themselves, so I get them to kind of start building what we call metacognition, which is an executive function that, is one of those things, like self-reflection and kind of thinking about experiences and being able to pivot. But I also show them a list and pictures of all the famous people in the world that have ADHD, because it is so common. It is so common. And kids are like, whoa, I have this in common with, Michael Phelps or Simone Biles or, Emma Watson. Like, it's amazing, right? Because I want them to know that even though you have ADHD, it doesn't limit you to reaching for the stars, right? Because these people have ADHD. They are just like you. They have brains just like you. And they've reached their goals. So you can too, right?
so
So
Simone
important to
Biles,
empower
Simone Biles has ADHD.
them.
Michael, Phelps? They
Mm-hmm.
do.
Mm-hmm.
All right. So you're
Mm-hmm.
asking Parameshwari, yeah. Phelps and Simone Biles. They have ADHD and they are world renowned. So
Yep. Yep.
mm,
Yep.
yeah.
Oh, and I've got a whole other list too. But yeah, I mean, there's so many people with
Wow.
ADHD. And, when you start talking about it with kids and you realize that they are able to do what they have and achieved, the sky's the limit, right? Sky's the
Mm.
limit. And one of the other famous people that kids really love is Dave Pilkey. So I don't know if you know who that is. He's an author of Dog Man, the series.
Oh gosh. Oh yes.
Uh-huh. Yeah. Yeah, Dog Man, right? And then I tell the kids, I'm like, okay, Dog Man lovers, what's the name of that robot in that book? And then the kids are like, ADHD. I'm like, yeah, that's the name
Oh,
of the robot.
oh. My kids love that book.
Yes,
Oh,
you got to go back and look,
look at
right?
the book. Wow. Good to know. This is so helpful, Dr. Bauer. This is awesome, awesome. I'm going to go look. I don't. I think that book is a little weird. I was like dog man, like really half a dog, but they love it, and they keep from the library. They keep getting it. That
Mhm.
is so. That is so awesome, man. This has been so rich. Thank you for those who have been watching. You got quite a few comments. Dr. Mitra, hi. Thank you for joining.
Oh, hi.
Bola has joined as well. And so many positive feedback. So this is good. Now, people are wondering, Doc, Teach Me ADHD program that you have set up. I mean, I love it. I love the idea of it. Now, for people who are wondering, where can we have you come on to speak? Maybe at an event about something like this, or how can we find out more information about your program? Where can we find you, Doc? Where can we find you?
Oh, well, so thank you. I love to meet everybody. I'm an extrovert, and so, reach out with any questions. Um, so you can go first and foremost to my website, which is letstalkkidshealth.org. And, I'll just tell you a very 2-second story, not 2 seconds, but my platform is Let's Talk Kids Health. And it's really a play on the word let's, because when I teach parent training
Mm,
workshops, we teach parents of toddlers and preschoolers not to use the let's command unless you're going to get up and help. Because, oh, let's go clean up
let's
the toys.
together.
And then you just sit there and your preschooler's like, come on, let's do it, and you
You
didn't really
know
need to
what?
do it. You meant you, right? Yeah. So we talk about the let's command because kids are very concrete. But I wanted to have my platform where everybody talks together. Let's talk about this. So kids and
I love it.
parents, families and doctors and educators, everybody in the community. I want everybody to be involved. And that's the signature of everything that I put together. So my course, Teach Me ADHD, is there's information on that. And that, as I alluded to, it's really meant for and recommended for kids 8 to 12 and maybe some mature 7-year-olds. But it's an 8-week course that you take together. Together. It's the only course that
Together,
I know of.
let's.
Yes.
Let.
See, let's. And it's the only course that I know of that kids and parents take together, but with up to 11 other families. And yes, it's on Zoom. And before you go why Zoom? We hate Zoom. We can't do Zoom anymore. I had to do it out of necessity, first of all, because I started it during the pandemic, right? However, kids just love to do it. It's accessible from their house. They feel more comfortable, right?
Mm,
And I try to make it accessible to as many families as possible. So that's why it's done remotely. But because it's on Zoom, I knew I had to sort of bring my game. And even though I'm very energetic, I also had to develop a detective theme. It's the All Deeds Help
I love
Detective
it.
Agency.
Yeah.
When you join, parents and kids have code names. You get a supply box. You get stuff like this. You get a map. You get, and
I'm
then
excited, Dr. Nerissa.
and then families, you get family missions that you do week to week because
Wow.
you're detectives, and then you have to take pictures of evidence to then send into headquarters for feedback. And the family missions are really designed to take everything that you learn week to week to then get you excited and then talk about it and then start working on it at home, teaching these skills, putting in place the systems that kids need to thrive. But the cool thing about this is because kids and parents are learning together and hearing the information together, they're getting the language down. They're getting the tools down. Kids are more prone to then be able to be like, okay, we got to do this because you know, and then they see other kids. That's the beauty. They get to see other kids and meet other kids because no kids go up to each other and say, hey, do you have ADHD? No, they don't do that. But in this course, they get to see up to 11 other kids and their parents and hear stories. Yeah, I have a hard time doing that too, or that happens to me. And what happens? All of a sudden, the kiddo realizes, oh, there's nothing wrong with me. I mean, I can tell them all these famous people have it, but there's still that degree of separation. It kind of feels a little bit unattainable, but it's kind of cool. But when we show them peers that are just like them and they're like, huh, hmm, it really does something. And for the parents too, it helps them feel less alone because it can be really isolating when you're getting calls from the school, you're
Right.
struggling, right? So that's the beauty of the course, is just having everybody together and learning. I
I
kind of
love
forgot
working.
I forgot the question.
Oh,
Actually,
no worries. That's
I have ADHD too, so I mean, I'm just kind of all over.
it. You're doing great. And I could tell the passion and the heart you put into it. It's obvious with how you talk about the program. I'm going to put those links after the live. So for those who
Yes.
want to connect with you, no problems, I'll do that. And one of the things I love about your program is that it brings the family together. It strengthens your connection because they're not forced, but they're encouraged to work together with this.
Mhm.
I can
Mhm.
tell you so many other things change for the better, even with this outside of ADHD. So I'm
Yes.
so thankful that you do what you do. I'm going to put your information on blast and I'm going to share it with everyone. And for those of you who are watching, please share with those who could find this useful. I've made it shareable. And these sessions are done to help empower you to live your best lives with or without ADHD. So thank you so much, Dr. Bauer, for being here. I'm honored and I'm really thankful. I've learned a lot, and so have my viewers.
Oh, well, thank you for having me. It was a pleasure talking with you today. And again, just connect with me if you have any questions.
Will do, will do. All right, for those who are watching live replay, thank you for staying on. This is the voice of Dr. Olabintan. And if you or anyone you know is looking for an awesome, passionate, thorough family physician, I almost forgot. I am she. Have a good one. Bye.